I have two sons. The eldest, his name is Akili, he's 4. Found out that he had sickle cell at 4 months. He had a consistent yellowing of the eyes. When I realized it wasn't getting any better, I decided that I was going to take him to the doctor. Dr. Palomino Lou immediately decided to examine him. When she checked his side, she recognized that there was a little enlargement there, and that is the spleen. The spleen is only felt in children that have sickle cell. At this time when she mentioned sickle cell to me, my whole world had went topsy-turvy. I mean, at that point in time, there was no thinking positive because I've lost a cousin to the disease already. I just didn't know how to handle it.
Sickle cell is a blood disease. It's an inherited blood disease, so you have to get a gene from your mother and a gene from your father for an individual to have sickle cell disease. And basically, red cells, which is what gives your blood the red color, are usually round. But in persons who have this disease, the cells tend to be sickle-shaped. Normal hemoglobin, there's iron, but the iron is in the middle, hiding. Because of the change in the mutation, the iron pops out, and the iron just goes around reacting with everything in sight. So sometimes the cells clump together and block the vessels, and that's what we get in painful crisis. It happens in the bone, in the vessels. So if you have blockage in a big vessel in the brain, you get a stroke.
It's been a journey, a very interesting journey. Ups and downs, peaks and valleys of him being in and out of hospital.
He, was transferred to the sickle cell unit up by UE. He had to be doing several blood transfusions. He was having heart failure, so to speak. He had a spleen that kept on getting enlarged. Now the spleen is there to help to protect them against germs and bacteria that is out there, and so that is what the spleen does. It collects the bacteria, but also when it gets enlarged, it poses a risk to them. It can burst and it can create complications and they can die. They had to remove the spleen at age 2. Ever since they had removed it, he now started suffering from the acute chest. And that happens because the spleen is no longer there. So the acute chest is similar to pneumonia.
When the time gets cold, I get drums and I get a cold and I get sick.
What I try to do is to just ensure that he has a lot of fresh fruits and vegetables. Try not to give him anything that's pre-processed.
It's a lot of work to maintain a child with sickle cell. You really have to love them, you have to support them, and emotionally you just have to make sure that you're always there with them 100% every step of the way. I can't tell you how important the support of family is.
Your highest risk of dying from sickle cell disease is in your first 2 to 3 years. But many people are not actually diagnosed until 5 years and up. So that danger zone is there. By doing newborn screening, as early as 2 months, you can start preventative measures.
For each person that don't know their status, they need to know. You need to know if you have the trait. My son having the trait, he now needs to understand that his brother has sickle cell, and when he gets to that age, he will learn about it. But he will also need to know that if you meet someone that has the trait, you have to be very careful.
If you've done a proper test and you don't have a trait at all, you can have a child with sickle cell disease, right? Now, if you have the sickle cell disease or you have a trait, screen early to find out what is the risk with this other person. And then you can make up your mind. Are you willing to take that risk?
You have just seen part 1 of a 2-part episode. Part 2 can be seen next week at the same time. Next week on The Teller.
This year we have a team of 550 participating in the run for the cause.
Them doing the Sigma runs and corporate charities, I am 100% in full support.
Almost $500,000 donated to the cause.
The Teller is brought to you by Scotiabank.